Hello, my name is Eric, and I'm the nurse that's going to be performing a head-to-toe assessment on our patient. First thing we need to do is make sure we have all of our equipment. I got my hand gel, so make sure my hands are clean. Got my pen light, my stethoscope, and my watch. So next thing I want to do is just greet the patient. Hi, Kyle. My name is Eric. I'm your nurse today. Can you tell me your first and last name and your date of birth, please?
Kyle Heimler, 2/11/1997.
All right, thanks, Kyle. And are you in a position of comfort? Okay. Just want to make sure that's important since before we go through the head-to-toe assessment. So can you tell me what year we're in?
It's 2020.
Okay. How about the day of the week?
It's Sunday
And where are you at right now?
at St. Charles Bend.
Okay. Thank you. So I'm gonna start. Just gonna put my hands on your head. He's got a nice head of hair here, so the hair looks good. Just gonna feel for any like lumps, masses, anything out of the ordinary. Everything seems nice. I'm gonna look at his eyes and ears, make sure everything is symmetrical. Eyes look good, ears look good. You have any vision issues, any hearing issues, anything like that that we need to know about? Okay, and how about with your head? Was there any discomfort when I was touching your head? Okay. Go ahead and open your mouth for me. Okay, that looks good. And then I'm gonna go back and just check his pupils real quick. And pupils are pearl. They are reacting appropriately and they are accommodating. Go ahead and open your mouth one more time for me. Okay, mucus looks good, color looks good, teeth look good. So like I said, I'm just gonna go ahead and check your neck. Let me know if there's any discomfort, any issues with your neck, any moving your neck, any swelling, anything that's abnormal. Okay, I'm just gonna check the jugular flow just on the carotid pulses here. Okay, those look good. Okay, and next thing we'll do is just check the upper extremities. You want to go ahead and just kind of move your arms around for me. Let me know if there's any discomfort with any of that. Okay, joints good, wrist joints good. Okay, his color looks good. I'll check his temperature. Temperature feels good. Skin's pink, warm, and dry. So that all checks out. Go ahead and wiggle your fingers for me. Okay, now go ahead and squeeze my fingers. Okay, strength is equal on both sides. Go ahead and close your eyes. And you tell me what fingers I'm touching.
My index finger on both ends.
Okay, so that all checks out appropriately. So next thing I want to do is we're going to check his apical pulse. So if you want to go ahead and lift up your shirt for me. And the way we're going to find that is we're going to do the mid-clavicular line down to the 5th intercostal space. So I'm just going to take my two fingers and just kind of fill in between each rib so I know that I'm in the right spot. We're going to be right about there. So now I'll take my stethoscope and we will take a listen. And I'll do that for 1 full minute. And we're going to start right now. So heart sounds good. Rate and rhythm is normal. His rate was right about 72. I was able to hear S1 and S2. So heart sounds good. I'll go ahead and keep these on. Go ahead and keep your shirt up for me, and I'm just going to listen to your lung sounds. Go ahead and take a breath for me. Again. Again. can, go ahead and lean forward for me, and I'll just listen to your back here. Good, nice, good breath for me. And again. Okay, breath sounds look good. Sound good in all fields. I'm gonna go ahead and just kind of stay in that position for me, and I'm gonna just take a look at your back. Any back pain, any back issues? I'm just gonna kind of feel the spine, check for any deformities or anything like that. Everything looks good, spine looks good. He reports no pain or no issues. So thank you, Kyle. Next thing I'm gonna do, I'm gonna have you go ahead and lay back. And I'm just gonna go ahead and pull your shirt up for me, and I'm just gonna listen to your bowel sounds, and I'll palpate your abdomen. And if you have any abdominal issues, any GI issues, nothing like that, nothing to report, nothing. Peeing normally and all that stuff. The output's about normal, and no issues there, no pain urinating, anything like that. Okay, so go ahead and take a listen here. Okay, bowel sounds are normal. So I'm gonna go ahead and just kind of put some pressure. Let me know if there's any tenderness anywhere here, okay? In there. Down here. Nothing. Over here. Okay. Any pain here? Okay, so our patient reports no pain, no tenderness. Skin looks good. Don't see anything abnormal, no lesions. No, it's nothing tender, so you can go ahead and put your shirt down. I already asked about urine output. No issues urinating, anything like that. He said everything's all normal. So I'll go ahead and move to the lower extremities. Go ahead and pull your pant legs up if you don't mind. There we go. So I'm gonna look for edema. Again, check temperature. Skin color looks good. Skin's pink, warm, and dry. No edema at all. So everything looks good here. I'm gonna have you go ahead and just kind of push your legs up against no pressure. There you go. Go ahead and do the other thing. Okay, go ahead and lift your legs for me. Go ahead and push them down. There you go. Strength looks good on both lower extremities. Again, color looks good. Turgor is good. And temperature, like I said, everything checks out with the lower extremities. So I'm gonna go ahead and pull off your sock here if you don't mind. Just gonna give your toe a squeeze and check cap refill. Okay, and the same over here. Check cap refill. Okay, that looks good. And then if you want to close your eyes, go ahead and tell me what toes I'm touching.
Big toe.
On both feet. Okay, excellent. So lower extremities look good, no edema. He's got equal strength. Cap refill looks good. I also would have checked cap refill on his fingertips as well. I would have done that when I was up the upper extremities. So other than that, we'll give you your socks back here. Other than that, I think the head to toe assessment went good. Kyle has no complaints to report. I believe we've checked all body systems appropriately, and at this time we'll go ahead and end our head to toe assessment. But I'm going to go ahead and jump right into some teaching with Kyle. So first thing I want to do is I'm going to teach Kyle. We've been talking about blood sugar, so I just want to teach Kyle how to check his own blood sugar. If he has any history of diabetes or anything like that, he would feel the need to do so. So I've got our CBG kit here, Kyle. So I'm going to kind of just explain everything to you, and then when you're done, I'll just kind of I'll ask you what we talked about, and I just want to make sure that you understand appropriately. So first thing we do, we got our CBG kit here. We'll get our strip out. Okay. So we're going to just insert that in the bottom. Once you do that, the machine will turn on. It's telling you that we're ready to put some blood on there. So let me go ahead and put some gloves on for this procedure. Okay. I'm going to clean the finger here, so you just want to make sure that finger's nice and clean. Just want to keep that sterile. And you're going to feel a little poke at the end of your finger. So I'll take off my cap. Just a little poke here, pal. Okay. That's good. Squeeze a little blood. And then once you get the blood out, you just put it on the strip. You heard it beep. And we're just waiting for it to read. Okay, blood sugar comes back at 81. So that's right within normal range. So we checked his blood sugar. We'll go ahead and clean that up for you. Okay. Do you think you need a Band-Aid, Kyle? Does that look okay?
Good.
Okay. So like I said, we just went through a quick demonstration on how to check his blood sugar. So Kyle, if you can just kind of run through with me real quick, kind of what we did. You don't have to re-poke yourself or anything like that. So if you want, just kind of explain to me with the equipment what you would do.
You grab your blood pressure gauge, grab one of the strips, put in right there in the slot, clean your finger, whatever one you're going to do, take a lancet, take the cap off, poke your finger, just put the blood on the end of the strip, and wait a couple seconds for it to give you the reading.
Okay. What would you consider normal limits or a normal range for your blood sugar?
80 to 100.
80 to 100. Okay, fantastic. Perfect, Kyle. That sounds great. Yeah, I think I'd feel comfortable with you knowing how to check your own blood sugar. So finally, I'll go ahead and just kind of clean up. We will dispose of our sharps in the appropriate sharp container, which I will do shortly. The next thing we'll do is just re-cleanse my hands, and then I will document appropriately in Kyle's chart about the head to toe assessment and our findings and the lack thereof, and then as well as our teaching moment with the checking the blood sugar. Any questions for me, Kyle? Okay, that is it.